How to properly doff personal protective equipment. Throughout this video, where the word patient is used, we are referring to patients, residents, and clients. Determine what zone you are in, green, orange, or red. If not in a COVID-19 unit, gloves should be removed or changed after the task you needed gloves for, if they become visibly soiled, or after patient or patient environment interaction. If removing after patient interaction, remove them before leaving the patient's room, care area, or home. In the COVID-19 unit only, follow extended use guidelines for gloves. Staff who enter the patient room or care area without direct physical contact do not have to change their gloves. Where there is direct patient contact, gloves must be changed when leaving the room. Gloves are to be worn in all areas, for example, halls, in the COVID-19 unit. To remove gloves, use glove-to-glove, skin-to-skin technique by grasping at the palm and removing the first glove, pulling the glove inside out. Hold the glove that was removed in the hand that is still gloved. Scoop under the cuff of the second glove with bare fingers and remove the second glove by pulling it inside out over the first glove. Place the gloves in the garbage. Perform hand hygiene. After you have removed your gloves and performed hand hygiene, remove your gown before leaving the patient's room, care area, or home. In green and orange zones, remove your gown after each patient encounter you needed to wear the gown for, whether it was needed because of your point of care risk assessment, like a complicated dressing change where irrigation is required, or if your patient is on additional precautions. If you are working in a COVID-19 unit, follow the extended use guidelines and wear the gown between COVID-19 positive patients. If your patient is on additional precautions for other reasons, for example, MRSA, your gown must be removed after the patient encounter and a clean one put on. You should always change your gown if it is soiled with blood and body fluids, and remove your gown at breaks and at the end of your shift. To remove your gown, untie at the neck, then at your waist. Scoop fingers under cuff of one sleeve, then pull sleeve over one hand. Use gown-covered hand to pull gown over other hand. Pull off without touching the outside of the gown. Roll gown inside out, holding the gown away from your body. Place the gown in either a laundry hamper or a garbage bin as appropriate. Perform hand hygiene. If using an overhead gown, gently pull apart perforated edges of gown at back of neck, then untie the waist. Once you are out of the patient's room, care area, or home, you can remove your eye protection and mask/respirator if not extended use. If there is an anteroom, you should remove your eye protection and mask/respirator in there. All staff should be following the extended use guidelines for eye protection. Remove and clean and disinfect your eye protection at break, end of shift, when driving, or when visibly soiled. Remove eye protection using the arms or straps. Inspect them for signs of soiling or damage. If eye protection is visibly soiled, the lens is discarded and frame disinfected with a facility-approved disinfectant. Perform hand hygiene. If eye protection is not visibly soiled, the lens and frame are cleaned and disinfected with a facility-approved disinfectant. See the Standard Operating Procedure, or SOP, for disinfecting eye protection on the Shared Health PPE webpage for more details. Some sites have medical device reprocessing to reprocess eye protection. For those sites, place in the designated spot. Perform hand hygiene. Place the lens on 2 facility-approved disinfectant wipes. Clean and disinfect the frame using a facility-approved disinfectant wipe. Then hold the frame in the air, allowing the necessary contact time for disinfection. Place on a paper towel or clean surface. Allow to air dry before reusing. Perform hand hygiene. Securely store the frame in a way it won't be contaminated or tampered with, for example, in a Ziploc bag labeled with your name. Return to the lens placed on the disinfectant wipes. Wipe all surfaces of the lens. Flip the lens. Wipe all surfaces of the lens. Allow the lens to sit on the wipes until the disinfectant wet contact time has been reached. Ensure the lens is dry and securely store the eye protection in a way that it won't be contaminated or tampered with, for example, in a Ziploc bag labeled with your name. All staff should be following the extended use guidelines for use of masks and respirators. Remove your mask using the loops or ties. Discard the mask and perform hand hygiene. For more information, refer to the COVID-19 Personal Protective Equipment Supply Management and Stewardship Planning and Guidance Framework on the Shared Health website. If using an N95 respirator, remove the respirator using the loops. Perform hand hygiene. Each respirator may vary slightly in the steps for removal. Please familiarize yourself with the instructions for the brand you are fit tested for.